Hello, my name is Elaine and I'm a PGY1 community-based pharmacy resident at Nationwide Children's. As current pharmacists, we all realize that we have an extensive knowledge about medications that we use to identify and prevent adverse drug events, or ADEs, that can help reduce healthcare costs. However, studies have only looked at the cost avoidance of pharmacist interventions in adult populations. Therefore, my study sought to determine the cost avoidance of pharmacist interventions associated with the prevention or management of ADEs in pediatric ambulatory care clinics. This project was a 4-month retrospective review at 10 ambulatory care clinics with embedded pharmacists. At Nationwide Children's, a standardized documentation workflow is already in place for the ambulatory care pharmacists to document the interventions that they make within the electronic health record. However, for the purpose of this project, we only focused on 6 interventions related to the prevention or management of ADEs as seen in Figure 1. Our overall project workflow had 3 main steps. The pharmacist would first document their intervention and further indicated an ADE subtype, a drug interaction, drug not indicated, prevent or manage ADE, or prevent or manage drug allergy. Next, the intervention review panel, which consisted of at least 5 members of the core research team, met together to assign a probability score of the ADE occurring had the pharmacist not intervened, which is based off of the validated Nesbitt method used in the other cost avoidance studies. We then assigned the level of care necessary to treat the ADE. I then used the average charge data for emergency department and hospitalization visits from the Pediatric Health Information System, or PHIS, which is a database that includes data from over 50 of the leading children's hospitals in the USA. For ambulatory care average charges, I used CPT code 99213, which correlates to a level 3 or intermediate office visit for children's hospitals utilized in the emergency department and hospitalization cost that had readily accessible charge master description documents online. Overall, my study included 407 interventions, with the median age being 20, as 3 of our clinics see both pediatric and adult patients. A majority of our patients were of white ethnicity and had Medicaid as their insurance coverage. The total cost avoidance from all of these interventions was determined to be $601,000, the majority coming from drug interaction and prevent or manage ADE interventions. In an analysis by clinic, the pulmonary and complex healthcare clinic had the most interventions, indicating that there is a lot of room for pharmacist interventions here. But this did not correlate with having a higher cost avoidance. The rheumatology and internal medicine clinics had the highest cost avoidance, which may be due to there being more patients on high-risk medications in these clinics, such as being on warfarin or methotrexate injections. Some limitations of my study was that we did not take into consideration non-adherence and ADEs related to administration supplies when reviewing interventions. To reduce guideline bias, we decided to not factor in patients' medical conditions and duration of treatment. Underdosing of medications are less likely to cause ADEs, so these interventions were also excluded. When assigning probability and level of care scores, we took a conservative approach and determined self-care to be $0 average charge, as to not overestimate the cost avoidance. Therefore, my study concluded that pediatric ambulatory care pharmacists optimize healthcare cost savings through the prevention and management of ADEs as integrated members of the healthcare team. As such, this data will be used to support the further expansion of pharmacists into pediatric ambulatory care clinics. I would recommend that in the future, an analysis of all the types of pharmacist interventions is done to get a more all-encompassing look at the total cost avoidance pharmacists bring to the clinic. Thank you for listening to this information on my project, and feel free to email me at elaine.young@nationwidechildrens.org with any questions. Thanks and have a great day.